Deja, thank you. The nation's largest movie theater chain, AMC Theaters, is reopening its doors at locations across the country today, including 5 spots in the Kansas City metro.
They're promoting cleanings between every showtime, socially distanced seating. So if you're headed out to the movies, what should you be the most cautious of?
So this morning, as always, on Thursday mornings, we're joined once again live by Dr. Dana Hawkinson from University of Kansas Health System. Doctor, thanks so much for joining us this morning, as always. Glad to have you.
Yeah, thank you.
So at the beginning of this, 6 months ago, it feels like now forever ago, there was a big emphasis on COVID-19 spreading through surfaces. We talked about how you should wipe down your groceries. It's a good idea whenever you come back. Has that shifted completely now to it being more concerned about spreading through the air? Bring us up to speed on what the debate there is between surface spread and air spread.
Yeah.
And if we're going to the movies, which one we should be more concerned about?
Yeah, right now, probably more of 80% being in groups, being together, the droplet spread. There is still that possibility that if you are sneezing, coughing, breathing otherwise, you can deposit those droplets onto surfaces, especially those high-touch surfaces. Depending how long it is before the next person comes along and touches that surface and then touches their face, particularly their eyes or nose or mouth, there is still that inherent risk there, although the major mode of spread is going to be when people are in larger groups together with no masks, and they do have the droplets which are being expressed into the environment. And if you're close within those groups, that is a good way to either inhale or get the virus into your other mucous membranes, which is your eyes.
So, Dr. Hawkinson, just to ask you personally, in your medical opinion, for your personal life, are you going to go see a movie anytime soon?
Probably not. I didn't go to the movies too much before. I just wait for it to come on demand at my home. There are ways to make it safe. It's just a matter of how much risk can one person tolerate. As we move further into this, we are getting more and more data and more information about the use of masks and how it does protect. We know that being distanced, so if the seats are far enough apart, is that going to reduce your risk enough? Mandatory masking in those types of situations, it's almost like you are in an airplane or a bus for 2 hours or 2.5 hours because you are in that confined space, although not as small as one of those. The movie theater certainly can be bigger, but can you be spaced enough? Is it mandatory that everybody is wearing a mask? Even then, you again may want to consider eye protection or goggles. That may be a problem with fogging, but those are things that you can do individually to mitigate and reduce the risk of spread in this disease that can be spread so much by asymptomatic people. But absolutely, masks are going to have to be mandatory in this setting.
Doctor, we want to talk to you about patients at University of Kansas Health System. On Monday, on our KU call, we learned more COVID-19 patients with no pre-existing conditions are needing to be hospitalized now. Between March and April, that number was around 6% of patients with no pre-existing conditions. But then between July and August, that's now up to 17%. What do you make of this?
Yeah, I think that just goes to the overall spread of the disease and in the particular populations that we have been talking about. It is still in the nursing homes and those people who are vulnerable, but we are seeing a larger proportion than we were early in the pandemic, just as you talked about, into that group of 20s to 40s who are otherwise out, healthy, have no pre-existing conditions that have been diagnosed. Meeting in large gatherings, meeting in groups, not really being concerned about the disease itself, because for the majority and the proportion that get ill, it's going to be very small in that younger age group. And so this just is another picture and another piece of data suggesting that, yes, in these young people, even though the chance of you having to go to the hospital and being on the ventilator is lower than, say, the older populations or other populations with medical conditions, you can still get it. You can still come to the hospital. You can still feel the effects of it. But that just goes to where we are seeing those younger populations, the 20 to 40 age group, is spreading the disease and is getting the disease.
Doctor, thank you so much for joining us this morning. We appreciate it as always.